Alrighty, everyone. Welcome back to another episode of the Make the Shift podcast. So, shifters, this is the Nursing Career Podcast. You're in the right seat. You're in the right podcast land. This is a mini-series podcast that we are spinning off of the Your Next Shift Mothership podcast. I spoke to that in the Burnout series too. So week after week on Wednesdays, we release a podcast where we interview a nurse who's doing any type of nursing, showcasing to the shifter audience, that's you, shifters out there, that there are options. You know, there are nurses doing diverse things, and if you're bored, stuck, or just unhappy with your job, you've got places to go and people to talk to. We've done about 140-ish, and again, as a podcast lives on in life, at this point you can find this, and there may be several hundred more, interviews with nurses from across the country, and we're bringing some of those folks back to help you make the shift in your nursing career. So we've done 3 previous interviews in this mini-series with Donnie. We're bringing her back for 2 more. So if you got to go backwards and listen to some of the others, that's perfectly fine. We've talked about what health coaching is in the first episode of that series. The second was more along the aspects of how is it similar to nursing. It's such an easy bridge to work with clients in that way. And last week, I should say, we spoke really to the legalities, some of the differences in education and training, and how not to let excuses and things like that slow you down. We're here today to talk business, a topic I'm sure Donnie and I are both thrilled to be speaking to. We did speak to this in the first of the mini-series recordings as we talked about money. So welcome back, Donnie, and let's get right into the business of health coaching. You know, we need to make money, otherwise a business goes south. And I know for one, I didn't learn business skills in my nursing education. Can we start an overview for the shifters out there of what exactly is a business?
Yes. I mean, I didn't learn business skills in nursing school either, but I can tell you that I looked it up. Now, I have been running my own business now for the past 6.5 years, and this has been my full-time income. This is it for Donnie. And so I've discovered a passion for business. So I am really excited about talking about this today. And in terms of what is a business, according to the Business Dictionary, it's a system in which goods and services are exchanged for one another or money. Every business requires some form of investment and enough customers to whom its output can be sold on a consistent basis in order to make a profit. And I know that nurses, a lot of the nurses that I've talked to, they have a hard time talking about money and profit. It's like those are bad words. But for those that are looking to make a business, it's something that we need to talk about. Actually, you know, there's 3 basic components to a business according to this definition, right? A business has to have a good or a service. It's got to have clients. It's not enough to have a good. It's not enough to have a service. You've got to have clients. And then you've got to have a way to monetize that service or to make a profit. So those are the 3 essential components for you to have a real business.
And you just said, Donnie, that you're passionate about talking about business, which I was like, ding, 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 perfect segue, because you know, how does a business differ from a passion?
Well, it's always great to have passion, okay, in a business. However, I have not yet been able to pay the bills with passion, right? So that is the difference between passion and business. You can have a huge passion, but if you don't have a way to deliver something to someone and get paid for that passion, then it just remains passion. It's not a business.
Absolutely. Absolutely. And I commend you. Let's go backwards in time a moment and just say 6.5 years of being in business, health coaching, paying your bills. Shifters, this is a reality that you too can make the shift and make it happen. So it sounds frightening to me. It sounds scary, quite honestly. I'm going to be putting myself out there. I mean, I'm still working on growing myself. And so here we are. And then a lot of shifters are thinking, well, I also don't have a lot of time, you know, because if I'm going to shift from what I'm doing into what I'm doing in a business, oh my goodness, how's it going to work out? So I'm curious, how would someone get started without doing a lot of busy work?
Well, you're absolutely right. There is a lot of busy work that people can get caught up in when they're talking about starting a business. And as we talked about in the previous episode, it's very easy when we're frightened. And I appreciate your transparency because I actually was too, right? And so when we're frightened, we look for ways to stall. And so we don't move forward. But what I can tell you is this, is that focus in on those three things. What is the service that you're going to provide? People get lost in what is my logo and what about business cards? Well, that's not the service that you're providing, right? Or they'll spend a year building their website and they don't have a service. They don't have a good, they don't have a client, and they're not making profit. And so we have to have those three elements. You know, in nursing school, I learned see one, do one, teach one, right? And so that kind of saved me some time in terms of reinventing the wheel, or learning how can I put it? Learning by trial and error, right? I could have started 500 IVs before I figured out that somebody would get infected if I didn't wash my hands first, right? But there were systems in place that saved me time and actually saved lives. Right? And when it comes to business, that is something that I also encourage people to do. Find somebody that is doing what you want and do what they're doing. See one, do one, teach one.
And who better to learn from, like you said, someone that's doing it. But I would add an additional disclaimer there, someone who's doing it and making the profit, making the money, the revenue that's paying their bills, making that income that's supporting their family. And Donnie, I know you do all of those things. So, you know, I'm curious, it sounds like that whole see one, do one, and are you going to help the person? And, you know, to me, that sounds fantastic. What kind of support do you provide? You know, what are some of the things that you would teach like a new nurse health coach about? You know, I hope that I'm kind of saying, Donnie, you're going to help us, right? What kind of support is it that's out there for that you give?
That is exactly what I do, is I help nurses start their business, their virtual wellness businesses. And the very first question that I hear from people often is, number one, how do I find clients? That is something that I help people with. And then once they start their clients, how do I really help them with this coaching thing? We talked about also in the previous episode how I would need an orientation if I went from my experience in oncology into labor and delivery. And so that's what I do, is I provide an orientation. How do you support your clients? And I use a very, very simple system so that we don't waste time in reinventing the wheel. We speed up the time from the idea to the profit. Because you're so spot on, Elizabeth. People will sometimes say, oh, I'm going to follow that person. That person has a passion. The question is, does that person that have the passion, are they living the life that you want to live? Do they have the results that you want to achieve? Are they being able to pay their bills? Or is this a fun little side gig that's actually sucking up all of their free time, right? And so these are questions that we really do want to ask. I have been health coaching now for the past 6.5 years. And not only has this been my full-time income for the past 6.5 years, but I also am my family's primary breadwinner. So I don't make fun money. I make real money. I mean, I make both, right? But the reality is that this is how I pay my bills. And you mentioned also something that I thought that was great in terms of feeling a little bit afraid. I was afraid of giving up benefits. The idea of running my own business, in my mind, I thought I would give up paid time off. And what I didn't realize is that as an employee, I actually worked for that time off. I earned that time off. And so it's not like it was gifted to me. Another benefit that I thought I was giving up was health insurance or health benefits.
Mm-hmm.
And once again, that wasn't gifted to me. It just so happened that they would take that money out of my paycheck before they deposited in my bank account. And so it felt like I didn't have to worry about it. And so now that I run my own business, I've got to tell you about some of those benefits. You know, my commute to work is about 3 minutes across the hallway.
Not even, probably, unless you walk really slow or your house is really big.
Yeah. And in childcare, you know, I'll be sitting here and working with my clients, and my kids will be next door playing and I can hear them. And so I don't need to worry about childcare. And in terms of health benefits, I have health insurance and I pay for it the same way I did before, except that now it just doesn't get taken out of my paycheck before I see it. I am the one that takes it out.
Mm-hmm. Awesome.
Same diff.
Yep, exactly. I mean, that it helps me to put this in perspective as someone who is, you know, focused on making the shift happen for herself. Shifters, I'm always share the truth, as Dottie said, you know, my honesty spills out of my face. You talk about money. We've brought it up several times. You mentioned nurses being uncomfortable talking about it. I agree. And I think I generalize that out to some more of the population. I'm not sure what that is about. However, you know, we need to talk about money. We need to make money to have that business be viable and continue. So this is something else that we weren't taught in nursing school, right? Shifters, like, we go to work and we're working with the patient. We're not learning about charging appropriate fees and collecting payments for the work. So I'm curious, you know, can you speak to briefly, as this is introductory and, you know, shifters, we got a certain time limit on all these mini-series shows. Can you speak to payment, pricing, and how to actually make money as a health coach?
Absolutely. Absolutely. So there's basically 3 different ways that you can make money as a health coach. Now, I do have to share a little bit about my background. As a nurse practitioner, I ran a weight management program for kids. It was called the Fit Kid Club. Mm-hmm. And I faced many barriers in terms of trying to implement a wellness initiative inside of the healthcare box. And one of those barriers was the idea that you really can't make money with wellness. And the practice that I worked at was amazing. They were amazing clinicians. They valued evidence-based practice, and they saw the need for the weight management consultations. But they were also very savvy business owners, which to me was a very foreign concept at the time. And so when they asked the question, how are we going to get paid? I got a little annoyed with that question. I was a little aggravated. I was thinking, don't you see the passion? Right? We're talking about passion and business. And that's when I started learning the difference. Mm-hmm. I was thinking, I have the passion. There's a huge demand. Why can't we do this? And they asked the question, how are we going to get paid? Mm-hmm. And inside the healthcare box, the question was, what insurance codes are we going to use? What codes are we going to use to bill insurance companies? And what reimbursement can we expect from those codes? And at that time, obesity was not even a diagnosis. And so we had to bill it as a family history of cardiovascular disease or family history of metabolic disease, which was never very difficult to find, a family history of any of those. However, it was always a thought process as a nurse practitioner, how are we going to get paid for this? And I came into this wellness business from the mindset that there is no money in wellness. And now, after 6.5 years, I can assure you there is, okay? If you are coming into this with that same mindset that I did, just rest assured there is. Now, 3 different ways that you can get paid for the services that you provide as a health coach. Number 1 is you can bill insurance companies. Now, there are some pros and cons to that, okay? The pros are that when we're talking about making money or exchanging a service for income, right? We also need to find out whether our audience, our target client, can pay for it. And what insurance companies do is they make it so that whether that individual can afford a health coach or not, if they've paid their premium and health coaching is part of that package, they don't need to worry about whether they can afford it or not. Does that make sense?
Yeah, absolutely.
So the benefits of accepting insurance payments is that in a way it increases access to care for individuals that might not have the means to pay for a health coach, right? Mm-hmm. The cons to that is that the insurance company is going to tell you what your time is worth. And more often than not, that's not very much. Okay. I know that until recently, I knew that there was a chronic disease management code that you can use to bill for virtual health coaching services. And you could make something like $42 to $49 a month for a maximum of 20 minutes of your time. So not only does the insurance company dictate to you how much you can get paid, but it also dictates to you what you can do. And that is part of the frustration that a lot of nurses already experience at the bedside or in their current positions, is feeling like someone else is telling them what they can and can't do, and knowing that they want to and can do more, right? Mm-hmm. And so that is one of the cons of insurance reimbursement. The other con of insurance reimbursement is that, as far as I'm aware, you must be an advanced practice nurse, either a nurse practitioner or a CRNA. As far as I know, not even clinical nurse specialists can bill insurance companies. And so for an advanced practice nurse to be able to bill insurance companies, they must become credentialed with each individual insurance company. And that involves time and money. Okay. So it could take 3 to 6 months maybe to get credentialed. And then once you bill that insurance company, it can take 1 to 6 months to get paid for that service. And when you get paid, as I mentioned, the income is not that much. So that is one way to get paid, is through insurance reimbursement. Another way of getting paid is through cash-based, concierge-type reimbursement, right? Where you provide a service and your patient pays you directly. So how much you charge for your services is now entirely up to you. Mm-hmm. Right? So you don't have an insurance company telling you can only get paid X amount of dollars. You can charge hundreds and thousands of dollars if you want to. And as a health coach, and the value that I know that we bring, I know that it's absolutely worth it. The fact of the matter remains, however, that it needs to be affordable to our target audience. Remember that to have a business, you need to have a service and you need to have a client, right? So if you have a service and you're charging an amount that you can't find any clients for, you don't have a business, okay? So it's about finding that sweet spot where it's worth your time and your clients can afford. And so the downside is that now it is dependent on your client's ability to pay, right? And sometimes the people that need it most might not be able to afford a health coach. And, you can research health coaches to find out how much they charge. I've found that they charge anywhere between $70 an hour to thousands of dollars a month, right. Okay? And so really it goes back to, who is your target audience? Are you aiming to help the rich and wealthy? Or are you aiming to really make a difference in America, where a lot of the people that need the most help are not the rich and wealthy, right? And so those are some of the pros and cons. You can charge whatever you want, but then you've got to find the people that are willing to pay for it. Right. Now, a third way that you can get reimbursement is actually through affiliates. And so bloggers do this all the time. They have affiliate agreements. And so the service they're providing to their audience is their content, right? And yet they get paid when they're affiliated with some product or service that might be relevant to their audience. Mm-hmm. And so that is another way that health coaches can get reimbursed, is through affiliates and offering a good or service that might be relevant to their audience and getting paid that way.
Mm-hmm. Excellent. So there's options. And what's interesting, the third piece too, you were talking about the affiliate, is like a referral. So if you refer to someone, it's like, thank you, here's a little piece of that pie for that referral, so I appreciate you laying them all out. Now I'm curious, can a health coach, like a nurse who's thinking about making this shift, can they stay in their job and build the business at the same time? Like, how does that work?
Yeah, that's a great question. Of course, there's many different ways. Today, we're talking about starting a business. We're not talking about the option of finding a job, right?
Right.
And what I do is I actually help nurses start their own virtual wellness business using a plug and play system that makes it very, very simple so they don't get caught up in that busy work of the website and all of that, because we actually help them with all of that.
Wow.
And so, the question that you asked was, can somebody build this business on the side as they're working? Well, I actually built my business on my drive into work. I drove 45 minutes each way. I worked 3 days a week as a nurse practitioner, 3 hours each day. I worked part-time. But for 3 hours of work, I was on the road for an hour and a half. And during that hour and a half, I built a business that completely replaced that income within about 3 or 4 months. Now, I do have to say that when you run your own business, there's never an income guarantee. And I'm not offering any kind of income guarantees, but I am saying that it can be done only because I've done it, right? And after about 7 months of driving and having a lot more fun on my drive to work, and realizing that I didn't have to bring germs home to my kids, and realizing that I can make the kind of difference and income that I wanted to, I quit my job. I pulled the plug, right? But that's something I wanted. I wanted to be home with my kids. Now, there's a lot of nurses that I know that they just decide to make this a part-time thing on the side. It's not their ambition to be home for any reason. It's not their ambition to make it a full-time gig, and that's okay. This can be done on a very part-time basis, but it can also generate a full-time income for those that are looking for that.
Exactly. And I know in the next episode, so shifters, stay tuned, we're going to talk to the support and resources, because you were just talking about the busyness of setting up that website, the busyness of figuring out how to get clients. And these are things that Donnie would support the nurse who's looking to be a health coach in a business to do. So this is awesome stuff. First of all, I'm super excited that you have, first of all, the experience and have done it yourself. That's the person I would learn from personally. And then secondly, have those resources to help people with. So shifters, we're going to speak to that in the next episode next week. But let's say someone's like, you know what, you guys, we've been talking about this for 4 episodes already. I'm very interested in having a business and getting started, and I'm ready to make that shift. Where can those folks find out more?
ElizabethScala.com/health coaching.
It's so fun when you say that, Donnie. Elizabeth Scala. I'm like, ElizabethScala.com/health coaching. So shifters, that's going to be in the show notes. That will be in your podcast player and all over the place to tune in and find out more. We'll have one more of these mini series for you. You can always go back and listen to the other episodes as well. So until then, enjoy your next shift. Thank you.